For ladies who are going to have a hysterectomy or you have recently had one, this video is to help you really define what red flags are, what are things that need that medical attention right away, when to check in, and also what to do to help some of your unwanted signs and symptoms. Now, plenty of women have a hysterectomy surgery and do just fine and recover great, but I think it's important to have this helpful info because there are a lot of women seeking out more information and may just get limited amounts from their doctor when they're discharged from their surgery. So if you have had a hysterectomy recently, make sure that any of these red flags that I'm about to talk about, you definitely get immediate medical attention and really pay attention to your body. The rest, the healing is so important. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, a women's health physical therapist that works with so many women that are dealing with pelvic floor issues, back pain, recovering from surgeries such as a hysterectomy. And I am here today to share some information with you that can be very helpful. Now, there are different types of hysterectomy surgeries. So if you've discussed with your doctor already what type is best, or you have already had your surgery, whether it's a partial hysterectomy or a total or radical hysterectomy, there are different reasons for those types of hysterectomy surgeries. And knowing that you have checked in with not only one surgeon, but more than one surgeon for a second opinion, you have found the right type of surgery for your need and the reason why you're having surgery to really solve your issue and concerns too. So with a radical or a total hysterectomy, you will have your uterus, your cervix, and your ovaries removed. And this may come with some symptoms that are going to accelerate the process of going into menopause because you no longer have the estrogen being released because you don't have your ovaries anymore. So some of those unwanted symptoms can be as follows. So hot flashes, night sweats, vaginal dryness, difficulty sleeping, mood swings and irritability, weight gain, hair loss, dry skin, incontinence, loss of bone density, and even rapid heartbeat or heart rate. Now, these are symptoms of having that drop in estrogen and your body going through these hormonal changes. So you can speak to your doctor about whether or not hormone replacement might be a good solution for you to get past this. And it's important to note that a lot of women do have symptoms of incontinence or having that bladder urgency or leaking after the surgery. My job as a pelvic floor therapist is to really guide women on how to work on the muscle tone in their pelvic floor, their vaginal wall area, their core, and the surrounding muscles of their abdominals and their back and their pelvis in order to support your bladder and prevent a prolapse or prevent any unwanted bladder control symptoms. And for women that have the hysterectomy surgery, if you are taking pain medication, it's important to know that constipation can be a side effect that's very common. Constipation can come with a side effect of being on pain medication, but there are things like a stool softener or some holistic options like a smooth move tea that you can buy in a natural food store, or even high fiber things that you can add to your diet that can help stimulate your bowels and make you be able to be more comfortable going to the bathroom. Because having constipation can cause you to bear down and really strain through your pelvic area, this is going to be uncomfortable when you are recovering. So avoiding constipation at all costs and doing the prophylactic and preventative things so it doesn't happen can be very helpful for your healing process too. I think it's important to note that every woman is going to heal differently and a timeline is going to be very different for a lot of women. Some women between 2 and 4 weeks may have a check-in again with their doctor. They may start feeling better, like they can be up and walking around. And other women, it may be 6 to 8 weeks before you really start feeling like you want to get out of bed and move around. It's important to listen to your body. It's important to note if you're having any increased pain or anything that's uncomfortable that you were not told about, that you definitely go ask your doctor about. But I think the timeline, you can't just put a number on it for every woman. It's going to look very different from person to person. So these are some of the common limitations that the doctor may give you, and you definitely want to take their advice and what they told you after a hysterectomy. But limiting your driving and not driving for at least 2 weeks after a hysterectomy is important. Plus, if you're on pain medication, not a great idea to drive anyway. The next limitation can be limiting how heavy of an object you're lifting. So if you're not doing your own grocery shopping, get your groceries delivered or have someone else do it, but you don't want to lift anything more than 5 pounds or anything like a heavy grocery bag for at least 6 weeks. This may be different from person to person, but I find that limiting that amount of strain on your pelvic area can be very helpful. So not lifting anything more than a heavy bag of groceries. You may experience fatigue for at least 6 weeks after the surgery as well. For any surgery, I see this as a physical therapist, that people feel wiped out. They feel like their body just is tired and not responding the way it was before. You have to undergo a lot of healing, and in the healing, all the blood flow goes to that area. It's going to affect everything else in your body, making you feel more worn out and fatigued, even with smaller tasks like getting dressed, walking to the bathroom, or going to get your mail. So common, simple activities can be more exhausting and fatiguing that you didn't experience before. So just know that is totally normal. You may even see vaginal spotting or discharge for up to 8 weeks. Your doctor will also talk to you about what is normal or abnormal for bleeding after and having spotting, but just know that is also something that can happen in the first several weeks after your surgery. Also, inserting anything into the vaginal area or having sexual intercourse for at least 8 weeks. And your doctor may put a different restriction than this, but this is important because that area is going to be tender and sensitive, and you definitely want to recover and don't want to do anything too strenuous too soon. So you can aid your recovery faster if you're doing things that are going to encourage rest and relaxation. You are keeping any surgical incisions or even those small portal sites, you're keeping them clean and dry, and you're not putting any excessive like lotion or other things that you buy over the counter over that area until your doctor says it's okay to do that. So you really are keeping your eye out for any signs of infection, like increased redness, swelling, or heat around the area, something that feels uncomfortable, or you're seeing any discharge, like abnormal discharge from that area. You should keep your surgical site, especially if you had an abdominal incision, keep it clean and dry and not keep something rubbing against it as well. It's also very helpful to do some very light and gentle exercises, like breathing exercises, some gentle stretching, and some walking. And light walking where you are getting some blood flow and circulation, it does help the healing process, but not overdoing it. So I usually tell people in the first couple weeks, balance it out with the same amount of rest as the same amount that you're up and moving around and doing some light walking. I also have a special program, so when you are fully cleared by your doctor for movement and activity, of discussing and teaching you strategies for lifting techniques, battling constipation, helping your pelvic floor muscles really restore and recover, and what you can do for your core if you want to get back into activity, but you're just not sure what exercises that are appropriate to do in that time span. So take a look at the link below this video and after the video, and you may find that helpful too, the Hysterectomy Recovery Success Program. So here are the biggest red flags of this video and what I wanted to cover. So if you're having any of these symptoms, you definitely want to get emergency help and go see your doctor quickly, contact your doctor. So number one is having excessive bleeding. Excessive bleeding, this can be described by your doctor as like passing a clot or something that is more than normal that is concerning to you. Or if you're soaking through a pad and you have been instructed by your doctor, you'll get some bleeding, but if it seems excessive to you, you definitely want to contact your doctor and make sure that everything is normal there for your healing. The next thing is having any severe infection symptoms. This could be around the incision or around your pelvic area, but anything with abnormal discharge, excessive pain, or an uncomfortable feeling, something that feels like it's not getting better, but instead getting worse, you definitely want to get that checked out to make sure if you're running a fever or you're feeling nauseous, vomiting, anything like that is signs for having a possible infection. So you definitely want to seek medical help. And then the last thing is having severe pain. And this can come with what I just discussed, an infection, but having any severe pain, pain, it can be a part of the healing process, but anything that increases or it's unbearable, you should not have to deal with that. So definitely check in and make sure that you're cleared, that everything is okay with your healing. So it's important to know those big red flags. I'm sure your doctor will cover that with you, but I wanted to reiterate it again because this can happen at all stages from your recovery, and not to scare anyone that's going to go into having a hysterectomy surgery, but you definitely want to be informed and educated about the healing process and make it successful for you. So the more you think about ramping up your exercise program, you want to have that clearance from your doctor that everything is good to go, you don't have any kind of infection, things are healing fine. And then it's important to get with someone that is an expert in pelvic floor therapy, just knowing what muscles and breathing exercises and pelvic floor strengthening exercises may be crucial for your long-term success and recovery after the surgery. And you may not even be recommended to see a physical therapist after a hysterectomy surgery. Many times women are not told there is such thing as pelvic floor physical therapists, but it is so helpful to learn more about your body and also empower you to feel more confident about your recovery and feel stronger if you're going to be lifting anything heavy, if you go back to strenuous exercise and you get back to the things that you loved doing before. It's important to have that expert guidance along the way. So I hope you found this video helpful. Once again, this is not to scare anyone that's going in for a hysterectomy surgery or just had one, but I wanted to be able to give you more education and guidance so you know what to look out for, and also bring up some of the things you may not have thought about. So thanks so much for watching. Once again, if you haven't subscribed to this channel, please do. I give out videos every week on common women's health topics. So thank you so much for watching, and hope to see you in another video.